Hi, we are going to see an NCLEX RN video based on mechanical ventilation. Mrs. Jones becomes confused. Her saturation drops at 82%. She pulls off her venturi mask. Her BP drops to 88 by 46. ABG are as follows. pH is 7.24, partial pressure of oxygen 58 mm Hg, partial pressure of carbon dioxide 62 mm Hg, bicarbonate is 34 milliequivalents per liter, saturation is 82%. So this is a case scenario which shows the patient is confused. The patient was on venturi mask but the patient has pulled it off. The saturation is getting dropped down. The BP is also dropping down. When you see the ABG values, you need to think about the normal value. You can find out the pH is lowered, partial pressure of oxygen is lowered, partial pressure of carbon dioxide is increased, bicarbonate level increased, and saturation is decreased. So all the normal values are absent. What is done for this patient is Mrs. Jones is intubated and given 1000 ml bolus of 0.9% NS and is transferred to the medical intensive care unit. The ventilator settings for Mrs. Jones is the patient is on SIMV mode. The tidal volume is 550. FiO2 is 100%. The SIMV is 12 breaths and PEEP is 5 centimeter of water. So here the patient is intubated and is on mechanical ventilator. You know that the indications for mechanical ventilation include acute respiratory failure, heart failure, exacerbation of COPD, protection of airway due to cardiac arrest, drug overdose or respiratory depression, and spinal cord or neurological trauma. Mechanical ventilation is not a cure for the patient, but it is a support for the patient to improve the ventilation and perfusion and to decrease the patient's work of breathing until the acute problem is managed. This is a thing you need to keep in mind when you are thinking about mechanical ventilation. So let's see what is being advised for this patient more. The admission orders. These orders are not only for this particular patient, Mrs. Jones, but when a patient is on mechanical ventilator, most of these orders will be there. So you need to think why these orders are there, because there is some need for the patient. Vital signs should be checked every hourly. Continuous ECG and pulse oximeter monitoring should be there. ABG should be taken 2 hours after intubation to see the changes. Daily lab investigation should be done, that includes ABG and CBC. Chest X-ray and ECG should be taken daily. The patient should be given IV fluids. Here we are giving D5 half NS with 20 milliequivalents of potassium chloride at 84 ml per hour. Potassium supplement needs to be given for mechanically ventilated patient. Enoxaparin 40 mg subcutaneously daily we must provide. Pepsid is an antacid and H2 receptor antagonist that should be provided to the patient 20 mg IV push daily. Methylprednisolone 125 mg IV piggy bank every 8 hours should be given. Nebulizer treatments with albuterol 2.5 mg every 4 hours and as per required. Bed rest should be provided to the patient. Maintenance of the ventilator settings, that means we should check for the patient's respiratory rate and other alarms and all. Strict intake output every hourly we should monitor. Head of the bed should be elevated at 30 degrees. Mouth care every 4 hours and as per required you have to do. Daily sedation vacation you need to consider. Place orogastric tube and begin enteral nutrition formula at 20 ml per hour. Increase it by 10 ml per hour until a goal of 40 ml per hour is established. Orogastric tube feeding should be given. And if the residual volume is greater than 100 ml, you need to hold the tube feedings. So these are certain things you need to consider for every patient. So you need to know about the ABG which has been taken for this particular patient after 2 hours. So after 2 hours, if you are looking at the ABG analysis, you can see that the pH is in normal range, partial pressure of oxygen, carbon dioxide, bicarbonate, and the saturation. Everything has come to a normal range for this patient. First question for this is, what is the rationale for being ordered Pepsid or famotidine 20 mg IV push daily when intubated and placed on the mechanical ventilator? In the case scenario, you saw that Mrs. Jose is given an order of Pepsid 20 mg IV push daily. So what is the need for this particular medicine or in all intubated patients, mechanically ventilated patients? Let's see the options. It is to decrease the inflammation in the airways. It is to reduce the gastric acidity, to minimize constipation, to enhance gastric emptying. The answer for this question is to reduce gastric acidity. For this, you need to know that Pepsid is an antacid H2 receptor antagonist. So that will reduce the acid level in the stomach. Nursing management for a mechanically ventilated patient. Already I have told so many points, but these 5 points are also very important. The head of the bed should be elevated between 30 to 45 degrees unless it is contraindicated. The second is suctioning should be done, chest physiotherapy, frequent position changes, and the activity of the patient should be increased. It will reduce the risk of aspiration as well as it clears the airway of the secretion. So we should promote all these things. Daily sedation vacation and readiness to wean assessment should be done. This is necessary because excess sedation may decrease the respiratory rate and effort of the patient, and we won't be able to know when the patient is ready for weaning from the mechanical ventilation. So we need to see the sedation vacation daily we have to check, and also we have to give and readiness assessment to wean from the ventilator also we need to check. Peptic ulcer disease prophylaxis. As told, medication that reduce the gastric acidity will protect the patient from developing peptic ulcer disease and gastrointestinal bleeding. So that prophylaxis drugs you should give. DVT prophylaxis, deep vein thrombosis prophylaxis. Treatment with anticoagulants and sequential compression devices has shown that it reduces the risk of DVT in the patients who require prolonged mechanical ventilation. So these nursing management points you need to keep in mind. Moving on, the next question. The nurse correlates which mechanical ventilator setting as most important in preventing alveolar collapse in Mrs. Jose. So Mrs. Jose is on mechanical ventilator and it has got some settings. To prevent alveolar collapse, what is the setting you need to keep in mind? FiO2 of 100%. It is not 105, it is 100%, sorry. The tidal volume of 550 ml, PEEP of 5 cm water, SIMV with rate of 12. When this question is coming, you have to consider what is the thing done for preventing alveolar collapse. To prevent alveolar collapse, you should keep the PEEP at 5 cm of water. For the answer given above, we need to know about what are the different mechanical ventilator settings. Mainly as a nurse, when you are the arrangements, the mechanical ventilator mostly is set by the healthcare provider. But as a nurse also, you need to know what are the important settings which we need to consider when the patient is on mechanical ventilator. First one is fraction of inspired oxygen. Second one, we need to think about the breath rate or F. Third ventilator setting is the tidal volume or VT. The fourth ventilator setting is PEEP, positive end expiratory pressure. So let's see one by one what is all these four things. First one is fraction of inspired oxygen. It is given as FiO2. That indicates the amount of oxygen the patient receives via the mechanical ventilator. The FiO2, it may be started at 100% if the patient is extremely hypoxic, and then we will decrease the FiO2 based on the level of ABG. The ventilator may provide FiO2 from 21 to 100% depending on the needs of the patient. What is our goal is to maintain a partial pressure of oxygen above 60% mm of Hg and saturation above 90 to 92% and with the lowest possible oxygen setting. So fraction of inspired oxygen, that means the amount of oxygen the patient receives via mechanical ventilator, we can set it from 21% to 100%. When the patient is immediately on the ventilator, we feel like more hypoxia is there. First you need to start with 100%, and as the ABG value gets better, we need to reduce the fraction of inspired oxygen. Second one is the rate. Rate is the number of respirations the patient receives per minute via the ventilator, and usually we will be setting it at 8 to 12 breaths per minute. This setting depends on the mode of the ventilation selected and whether the patient can breathe spontaneously or whether the ventilator needs to provide mandatory ventilation for the patient. The rate also, we will be starting from a higher rate, that is 12 breaths per minute we will set first. Then it will be decreased in the patient who is breathing spontaneously until the patient is able to maintain adequate ventilation. So rate is the number of respiration the patient receives per minute via the ventilator, and when a nurse is documenting the rate, it includes the number of both the ventilator and the spontaneous breaths. Third one is tidal volume, that is 8 to 10 ml per kg. So based on the patient's weight, we will be keeping the tidal volume. If the patient is 55 kg, we will be putting the tidal volume 550 ml. Okay, so tidal volume or VT, that is the amount of preset air that is delivered with each breath. That is preset air that is delivered with each breath. The adjustments in the tidal volume also will depend on the ABG result. If large amount of the tidal volume is given, what happens is it will result in barotrauma, that is injury to the lungs will happen which is caused by the positive pressure. So barotrauma is a major problem in the patient with mechanical ventilator when tidal volume is too much more. So according to the patient's weight only we need to keep up the tidal volume. Using a lower tidal volume, that decreases the risk of further lung injury. So tidal volume, it should be kept at 8 to 10 ml per kg. Fourth one is PEEP, positive end expiratory pressure. It is the positive pressure applied at the end of expiration to help prevent alveolar collapse. It assists in patent alveoli and redistribute fluid from the alveoli. PEEP actually it improves the oxygenation. It allows the FiO2 level to be lowered. This is very much important because prolonged use of high FiO2, initially we started with 100%, isn't it? So that can cause lung injury. PEEP is often ordered at a level between 3 to 5 centimeter of water to minimize the alveolar collapse, and it is based on patient's underlying pathophysiology. So if in a spontaneously breathing patient, this PEEP is known as CPAP. Hope you understood these 4 main settings which a nurse need to consider. One is fraction of inspired oxygen, that is FiO2. It should be kept from 21% to 100%. Always try to reduce it from 100% when the patient improves. The rate 8 to 12 breaths per minute, and the rate also should be reduced. The tidal volume 8 to 10 ml per kg, that is based on the patient's weight. PEEP 3 to 5 centimeter of water, that is to protect the alveoli. The question which we previously had is, what prevents alveolar collapse? So the answer is PEEP setting. Hope you understood the mechanical ventilator setting. Next question is, the nurse is screening patients for the risk of developing ventilator associated pneumonia. The nurse considers which patient at greater risk of having a ventilator associated pneumonia. When we talk about ventilator associated pneumonia, you know that it is a healthcare associated infection that typically develops 48 hours or more after endotracheal intubation. So the options here are, what is the risk of developing VOP? That is the question. A patient who was extubated within 24 hours of being intubated, you know that there is not a problem. A patient intubated and placed on mechanical ventilation less than 72 hours ago. Here, this question shows that the patient is on mechanical ventilator and the 48 hours have passed. So, there is a chance of developing VAP. A patient with the head of the bed elevated 45 degrees, for the prevention of VAP, the head end should be elevated from 30 to 45 degrees. So this is not the answer. A patient who was placed on a nasal cannula after being extubated. After being extubated, nasal cannula must be provided to the patient, and that is not a risk for VAP. So the answer here is patient intubated and placed on mechanical ventilation less than 72 hours ago. A nursing preceptor is observing a newly hired nurse prioritizing patient rounds. The correct prioritization of assigned patient is indicated if the new nurse assesses which patient first. So, a new nurse has joined the clinicals and the preceptor is there, and preceptor is seeing how the new nurse is prioritizing the patients for the rounds. So let's see the options. A patient with cellulitis of the right lower leg, a patient who was extubated 2 hours ago, a patient who was ordered nebulizer treatment as required, a patient with an IV of D5 half NS at 125 ml per hour. This answer is quite easy. The patient with cellulitis of right lower leg we can watch out later. But a patient who was extubated 2 hours ago, actually after intubation when we are weaning, re-intubation is the major concern when the patient is extubated. Aspiration is also another important concern when patient is being extubated. So there are chances for problem with the patient who has been extubated. The healthcare provider has to order oxygen either by nasal cannula or by face mask for this extubated patient. That means the patient is on oxygen supply. The nurse need to monitor the vital signs, continuous pulse oximetry, cardiac status, respiratory status including the respiratory rate and effort for the extubated patient. The patient should be monitored for any signs of airway obstruction such as dyspnea, cyanosis, coughing and stridor. And when any problem arises, healthcare providers should be immediately notified for re-intubation of the patient. So the second point the nurse should take as the most priority. The third one is patient who was ordered nebulizer treatment as and when required, not too much prioritized. A patient with an IV fluid also not require that much priority. Hope you understood these answers. Thank you for watching. Please do subscribe for more videos. Thank you.